Right. Now learn some things which are new to you. Whenever you get a passage, then what are you supposed to do? You have to do two different things. There will be two different things. Right. So what do you mean by uh, reading, first of all? Reading doesn't mean reading from the beginning to the ending. Reading means some special style of reading. Okay, I'll give you some special style of reading. What does it involve? It involves in creative style, some advanced style. What do you mean by advanced style here? Advanced style means using some techniques and strategies. Now, what are those techniques and strategies? You can make down some notes. I'm not going to write everything. So those are, I'm going to, because this is going to be a flood of information. Flood of information. Keep your notes ready and write whatever you want. Okay. So there, so what you can do is, you can do skimming. Number one is you can do skimming. You can do skimming. Now, what is this skimming? Let us see. What is this skimming? And in this skimming, there are two steps. In the skimming, there are two steps. The first one is, okay, yeah. So here, skimming has two different things. First one is skimming the title, and second one is skimming the subtitle. Skimming the title, skimming the subtitle. So that's what you are going to see here, right? That's what you are going to see here, right? Um, Now, number one. Yes, now let's go to skimming. Okay, all the students, I'm going to give you 4 different sessions. In all the sessions, there will be different things. I'm going to teach you the best and the gist of it. Whatever I'm teaching in the morning, I'll not teach in the afternoon, not in the evening, not in the night. So everything will be different. If you attend all the 4 sessions, it will be really beneficial. Okay. So morning test, one paper. Today I'm teaching part A. So morning I'll teach different one, sample test one. Afternoon I'll teach sample test two. Evening I'll teach sample test three, and night I'll teach some other one. So like that. And so if you attend all the 4 also, it is beneficial for you. All the 4. So it is according to your wish. Okay. It is according to your wish. Right. Um, right. So now coming to the point, when I told you, yeah. So there are 3 different things. So advanced reading styles, we call them. Advanced reading styles. Advanced reading styles. Okay. They are 3 in order. So number 1, skimming. Number 2, scanning. Number 3, studying. So these are the 3 things that we have to do. Now first one, we are doing the skimming. So first one, we can say ABC. We can say ABC. Okay. ABC. Now, if ABC we are taking, the first one is A, skimming. So in skimming, you have two steps. One. Number one is skimming the title, and number two is skimming the subtitle. Skimming the title and skimming the subtitles. So this is right. Now, if you see carefully, okay. Now here first the title. You can notice the title here. The title is very clear in front of you. So the first step, total 10 steps you have on all the reading. Total 10 steps in all the reading. In all the reading, there are 10 steps. So skimming 2 steps, scanning 5 steps, and studying 3 steps. So skimming, scanning, studying. Skimming, scanning, studying. That's all. Skimming 2 steps, scanning 5 steps, studying 3 steps. So that's all. So now I'm talking about, yeah. So advanced reading styles have 3 different things I told you. One is skimming, one is scanning, and one is studying. Now let us see about skimming. So skimming the titles and skimming the subtitles. So you have to skim the titles and you have to skim the subtitles. Now, then you will understand where is what. So simple it is. You can understand where is what. Now just go through this title. Go through this title. You will understand for a second what it is all about. Okay. Just I'm giving you 30 seconds because this is very important. This is very, very important. I'm going to tell you that. Okay. Now, skimming the title. So this is the title you have seen. Now, when we talk about title, so this is the title you can see on the top. So on the top of the page. So we have 4 pages. So if we take 4 pages, the first page is not needed, so eliminate it. The last page is not needed, so eliminate it. So we have 2 pages. So first page and second page. Right. Right. So copy. Yes, this is there. I'm going to post it in the Telegram channel. Okay, this is text. Okay. Fractures. Okay, before this one, I have to give you something else. Yeah, this is the title. Yes, this is the title. Now let us see. So this is the title. Okay, fine. So skim the titles. Okay, right. Fine. Just 1 minute. I will tell you something regarding our timings. Let us see what the timings I gave you. Yes. Yeah. So, right. We have the first timing, first batch, that is morning batch. Those who have joined, you can join whichever batch. If you want to attend all the 4 sessions also, you can attend. So the first one will be from 10, okay, morning. So A, that is morning batch. Okay. This is for reading only. Reading only course. So first one is the morning batch. That will be from 10 to, so 1000 to 1200 hours. 1000 to 1200 hours IST. This is only for the regular students, not for everyone. Okay, those are registered. 1 second, please. Hello, Chitra. Good morning, beta. Yeah, tell me. Okay, you can join now. I'm sending the link. Afterwards, can we discuss? Because I'm in the session now. Is that okay? Huh? No problem. I know you. No problem. No problem. I will discuss with you afterwards. Okay? Right? Right. Right. Okay. Yeah, okay. No problem. I'll consider you. Okay? Okay. Okay. So, second batch is 13 to 1500 hours IST. So that is the second batch. Then the third batch is C. That is the evening batch. Evening batch. So note down all of you your timings. Evening batch. So that is from 6 p.m. 6 p.m. to 8 p.m. So 1800 hours to 2000 hours. IST, Indian Standard Time. The fourth batch is D batch, that is night, or you can call this as Middle East batch. Okay, this is 2300. 2300. Why don't we change to 2200? Yeah, we'll change it to 2200, no problem. 2200. So we'll close it by the day to 2400 hours IST. Yes, right. So these are the timings. Fine. So you can note these timings. So copy, right? So there you are. I'm putting in the Telegram channel also. So there it is. Right. So I put it in the Telegram channel also for your reference. So now, if we go to skimming, there are 2 steps. I told you, total 10 steps. So reading involves 10 steps. This is not reading actually, this is studying depth, higher level of reading. Everyone will read, but we are special. You have to be special to get special results. So what you have to do is, first one, skimming 2, scanning 5, and studying 3. So 2 points we are going to learn now. This is the first step. First step is study the title. Study the title, not read the title, study the title. So when you say fractures, when you say dislocations, when you say sprains, so these are 3 different types of consequences when you fall down, or when you get into an accident, or when you get into some problem. These are the 3 different things. Suddenly you fall down, there may be chances of 3 different things. So first one is normal problem, medium problem, serious problem. So we'll say the priority is from serious to normal. The most serious will be first, that is fractures. Fractures means slit of the bone or break of the bone. So some fracture of the bone. So that means there will be some gap or thin ridge, and you can, the gap will be formed. So the inner particles can come out and the outer particles can go in, or whatever. Okay. So otherwise that is very strong, nothing will happen. But now after the fracture, there's a problem. So that should be covered and it should be normal. Otherwise there will be severe pain and a lot of problems will be there. Fracture. Okay. Next one. Second one is dislocations. Dislocations means the bone will be out of place. The joint will be separated. The rib will be moving up or down, pushed up or down, because suddenly you fell down. Okay. So ankle, twisted ankle. Okay. Okay. Twisted knee, joint misplaced. They will become something like round or something like out of shape. That is called dislocation, because the joint went into a different place. So for example, this will turn like this one and this will come out of the joint. Something like that. So that is called location. Location is changed. Is not in the right location. Little or more change in the location is a dislocation. Sprain. Sprain means no fracture and no dislocation, but the muscle has some problem. It becomes a swollen, becomes irritating, becomes scratchy, it becomes painful. So that is sprain. So 3 different types. So this is called types. So there are 3 types. There are fractures, there are dislocations, and there are sprains. Now, this is what you have to concentrate and you have to study. If you study this, this will be very easy for you. If you don't study this and you directly jump for the answers, it will be very difficult for you to write. Now, I'm giving you 30 seconds again to study something more. So, in 4 different parts, reading part A, there will be text A, text B, text C, text D. Now, you guess what may be there before going there. Guess what may be there in text A, text B, text C, text D without opening that one. That is called common sense. Guess what will be there. So fractures, dislocations, and sprains. So you reason there. What you have to reason is, why these things happen. That means causes of causes. Number 1, write down in your notebook. Every title will have the same things, almost always. Any will take 12 things, and any 4 will come, automatically 4 will come there, because 4 different areas are there. So here for this fractures, dislocations, sprains, causes, maybe one topic. So text A, B, C, or D, maybe causes. So write down number 1, causes. Then number 2, there may be types of problems. Already we have seen fractures, dislocations, and sprains. Types can be other. Okay, causes. Write down number 1, causes. Causes means you can also say reasons, factors. These are the synonyms. These words may be there in the question or in the passage or in the answers. So write down, I'm giving you synonyms because you have problem with synonyms. Causes, factors, reasons. Causes, factors, reasons. So this is one type. Second one is types. What are the different types of fractures? What are the different types of dislocations? What are the different types of sprains? So there may be types. Types can be otherwise named as classes, types, classes, kinds. Write down all of you. Types, classes, kinds, categories, or groups. Types, classes, kinds, categories, groups. So these are the labels for the second one. That means different types or different classes or different categories. Everything is the same, but names you are giving different thing. That's all. You have to be ready with, because any of these words will be there. Any of these words will be there in the question, which will help you to find the answer. That's all. So next one is third one. When fractures happen, what are the on-the-spot actions? That means immediate remedies. Immediate remedies. Maybe some people may apply balm. Maybe some people may give some pain, means some tablets on the spot. So by neighbors, friends, family members, relatives. On the spot action. On the spot treatment. Immediate treatment. So before going to the hospital. So what are the treatments given? For example, when somebody is involved in burning, fire accident, then immediately you'll cover with a blanket. So you'll not pour water on him. And you'll put off the fire. So some things you'll, okay, if any clothes are there which are not burnt, you'll remove the clothes. Okay. So because that, and not remove the clothes which are already burnt. That means if you remove it, your blood will come out. So there are some things. So in the same way here also, fractures. Some ointment, you'll make him sit, you'll make him relax, and you'll just try to pacify him. Something. And you'll give some medication for pain or pain relief. Okay. Or make him drink some water or something. So that is immediate treatment. Immediate treatment. So what you are going to do? For example, snake bite. So for example, it bites here. Immediately you tie some hard rope or something like that to your, so that the poison may not come up. So like that. There are some things which you have to do. On the spot remedies. So that one. That means before going to the clinic. Before going to the clinic. That means general on the spot remedies or immediate remedies, unprofessional remedies, unprofessional. So anybody can do this one. Family members, friends, relatives, neighbors, whatever. So that may be one point topic, what you have to do before going to the hospital. Then next one, then you will call the ambulance and you will be taken to the hospital. At the hospital, on the spot, before treatment, okay, before, they will just examine, physical examination. There may be physical examination. So what happened, why happened, everything, physical examination, how it is, where the pain is, how much intensity the pain is, So you will just presume or assumption. It's not a diagnosis. A preliminary diagnosis. We say preliminary diagnosis. It may be right or it may be wrong. Preliminary diagnosis. Assumption, based on assumption. So the doctors and others, they will get some examine. Then afterwards, when the need is there, based on the preliminary examination, you will send for X-rays and some tests. So there are some tests and X-rays. That means laboratory reports, tests and reports. We'll send for them. On that, you will get a final diagnosis. So, final diagnosis. Then there is a treatment. These are all different things. So, treatment starts. Treatments are of different types. Medication is one treatment. Physical exercises are another treatment. Diet is another treatment. It may be different types, multifarious. So do not eat these foods because you have fracture. If you have pus, do not eat these things, these green grams like that. They'll suggest you what type of food you have to eat. So for every different problem, there may be different type of treatment. So treatment may be related to medication. Treatment may be related to exercises, physiotherapy exercises. Treatment may be related to diet and nutrition. So strong food you have to eat, so that calcium you have to take more calcium rich diet, we say, because this is a fracture, calcium rich diet. So you have to think like this one. So when you think like this one, you'll get a lot of things. Why I'm telling you, there is a reason. So one test you think like this, and the next test it will be very easy for you. It will be very easy. So because this is a lecture, I am telling you in detail, so that I'm opening up your mind how you have to think. Thinking is very easy, you can think very fast, but I'm telling you what are the different ways of thinking. So the next one, what are the drugs? What are the different types of drugs you have to use? Medication. So children, different type of medication. Adults, different types of medication. So based on child or adult, that also is there, because heavy doses cannot be given to children. Okay. And the next one, so what type of treatment? For example, fracture. What type of treatment we have to give? Should we apply a bandage, back slap, plaster back slap, or not necessary? Should we use a sling or not necessary? So, where is the fracture? What type of plaster back slap is required? So, how much rest should be given? So, advice, suggestion. Okay. And then encouragement and motivation. Okay. Comforting, providing comfort, appeasement, all these things. So these are the different areas. Now let us see. We have seen that there are fractures, dislocations, and sprains. Right. Now after this, yeah. Right. So skimming, we are seeing the skimming now. So in skimming, we have seen the title. Sorry. The tea boy, please. So these are the three levels. The three uh, uh, strategies. the three strategies, the three, you can say, mind-blowing strategies. The three mind-blowing strategies. Many people don't know what is skimming, first of all. I'm teaching you now what is skimming. Okay. So now in skimming, you have two different things. In skimming, you have two different things. So in skimming, you have three different things. What are the three different, in skimming, you have three different things. So the two steps in skimming, the two steps in skimming, the two steps in skimming. What are the two steps that you have to follow in skimming? What are the two steps that you have to follow in skimming? Skimming the titles. That is what we have done. This skimming the title you have to do in 30 seconds. 30 seconds. Sir, we have 15 minutes, sir. In that 15 minutes, if we spend this much time on this one, we'll be wasting time. You don't know, you're going to save 10 minutes. If you do this properly, you'll finish all the 20 questions in 10 minutes. In 10 minutes. Just trust me. Just trust me. Learn that. Reading is an art. Reading is a skill. Every Tom, Dick, and Harry cannot do it. Remember that. So now skimming the titles is over. Now skimming the subtitles. Skimming the subtitles. So now let us go to skimming the subtitles. Now subtitles. Now let us see subtitles. So first one is text A. Text A. Text A. Title. Now what is the title for text A? Now let us see the title for text A. Now, so this is the text. What is the, this is, what is that? Fractures, comma, dislocations, and sprains. The texts, page 1. Okay. So copy selected graphic. Yeah. So this is page 2. This is page 2. Right. Now we have seen these two pages. So you can see, now first one is, this is the text A. Thank you, Naman. Text A. Now here is text A. So text A. Text A is very small. Text A is very small. So this is text A. So what can you give title for this one? For text A, what title can you give? Now let us study only scanning the subtitles. Now we are scanning the subtitles. So this is, yeah. So now let us see this. This is text A. This is text A. Now you can see it very clearly. Okay. Yes. Now what I want, yeah, this is another student. She sent me her result today. Okay. I'm really very happy. She attended some of our sessions. I think, okay. She is from Oman, from Kerala. Tattile Reena Kurian. Tattile Reena Kurian. Okay. These are her results. She very happily said, sir, I passed, sir. I forgot to tell you, I'm sending you now. So this is, she wrote the exam on 20th March. 20th March, and she got result. Okay. She said, I got Ireland score. She got reading 320, listening 350, speaking 380, and writing 350. Okay. Right. This is the score she got. She sent today morning only. She sent. She said, thank you very much, sir. Okay. Now, yes. No need to hurry. Now we are doing scanning the texts. Scanning the texts. Okay, scanning the texts. Okay. Just bear with me for a few seconds because you'll get making it a standard. Okay. So that we can get a bigger font. Yeah. We can get a bigger font. The more the space, the bigger the font. So, so now we have, see how nice it is now. Right. Okay. Yeah. So now, I did not call you. Okay. Chinna, now I am calling you. Sorry. Okay. Find out office ki the office kosam only office kosam commercial ఉన్నది. Okay, start చేద్దాం. Okay, నేను దొరుకుతాను చూడు సరేనా within 2 days 3 days. I'm facing a lot of problem. I'm facing a lot of problem. పెద్ద హాల్ లాగా కావాలి 20 members seating capacity ఉన్నట్టుగా క్లాస్ రూమ్ కావాలి అర్థమైంది పెద్ద హాల్ కావాలి ఓకే వీడియో తీసుకోవడానికి అన్ని తీసుకోవడానికి ఈవెన్ ఇఫ్ ఇట్ ఈస్ ఊరి బయట అయినా పర్లేదు ఎనీవేర్ ఇట్స్ ఓకే బట్ ఇంటర్నల్ ఐ వాంట్ నాట్ ఎక్స్టర్నల్ ఇంటర్నల్ ఇట్ షుడ్ బి వెరీ లైక్ ఏ యునో బిల్ గేట్స్ ఆఫీస్ ఎట్లుంటుందో అట్లా ఉండాలి నాకు లోపల మంచిగా క్లాసీ ఉండాలి ఓకే ఐ వాంట్ ద బెస్ట్ రైట్ సో now see here right so this is text A title we don't know what is the title for this text A but what we can do is so text A we don't know the title but we can give a title for this one now if you see clearly there are some bold letters fractures dislocation and sprain don't read anything else don't read anything else please yes don't read anything else see here fractures when you notice there are 3 things which are very bold okay they are very bold okay now you see first one is fractures second one is dislocation third one is sprain that means he is grouping these things into 3 different categories so categories of problem that's all 3 different categories of problem that's so simple so simple so when you see these bold letters you should realize that these are categories so text A is related to categories so we can mark this one as categories so we don't know the title so we don't know the title of this one so title is what title is what we don't know so what now we have understood that this is related to types or kinds or classes or categories that's all so simple as that why do you want to read all this nonsense for that purpose there is no need at all so text A we don't know the title so we questioned it we got 3 bold letters and we marked it out fractures dislocation and sprain they are the categories they are the categories so simple as that to screen so first text is related to categories so title subtitle A subtitle of text A so coin what coining so it is categories right you can say types or kinds or classes or varieties I'm giving you all note down I'm not mad to give all these things types kinds classes varieties and categories already we said types kinds classes, varieties, groups, categories, divisions, divisions. Okay. Um, okay. So these are some. Okay, fine. Now, any title you can give, you can say types, or you can say kinds, you can say classes, you can say varieties, you can say groups, or you can say divisions. So don't hurry, please. One day you concentrate. One day you concentrate, and everything will be fine. So it will be very easy for you. So next. So we understood what the title is. So next. This is text A. So simple as that. Next one is text B. Text B. We don't know the title of text B again. So leave it. Leave it. Afterwards, we'll see. Now here, let us see what is text B here. Text B is from here onwards. Edit. Take snapshot. It's a little big. We can make into 2 or 3 parts. Copy selected graphic. Text B. This is, did I put text A there first? Text A is there. Okay. So this is text B. Now, why I'm going to show you in bigger font so that you can see clearly on the screen. No problem. I can take that pains for you. Okay. So now close it and again open. Yeah, because I have to copy paste. So he already gave the title Simple Fracture of Limbs. That's enough. Simple fracture of limbs. So text B, simple fracture of limbs. So just he has already given simple fractures of limbs only, not other parts, not stomach, not head, not body, not head, hands and legs, that only. Simple fractures, only simple fractures. Here, if it is simple fractures, there may be some special fractures or serious fractures. Try to understand why he told simple, because he wanted to differentiate and say that these are simple fractures, ordinary fractures, common fractures, usual fractures, normal fractures. See how I am getting the words. Your mind should be like that. Okay, right. Now here, so we got the title. Okay, simple fracture of limbs. Simple fractures, simple fracture of limbs. Simple fracture of limbs. Okay, we don't know the title. So we got the title now. Text B is related to simple fracture of limbs. So simple. Now here, this can be, say, let us take by A. By 1. By 1 means we'll make it into 2 or 3 slides. Because all of them we cannot. So this is immediate management. This is one group. Copy. Immediate management. Immediate management. Immediate management. Okay. So this is for your convenience. I am giving you like this. Okay. So Right. Okay. So immediate management, there are 3 points. We don't need that one. So we can take this one immediate. So that is management. This means simple fracture of limbs. Simple fracture of limbs. That means, okay, you say immediate management. We can see here. In this one, there are 3 different things. Immediate management. That is number 1. So that is why I separated this one. This part is immediate management. Right. Next one is, we don't need to read all these things. Just I'm making slides for you. Okay. Next one is clinical assessment. Clinical assessment. So all these things, clinical assessment. Assessment means before, just assessing, clinical assessment. So we can write here clinical assessment. Okay. So clinical assessment and then examine. That is different. This is clinical assessment, this is examine. So we can make this one into 2 parts. We can take this one clinical assessment first, then examine next. Examine, check whether we'll take next. Okay. So this is number 2. So fine. Yes. So clinical assessment. This is talking about clinical assessment. Okay, so that's why I separated this one. Next one, this is 3. This is 3. So remove clinical assessment. Okay. Then examine and check whether. So there are 2 here. So let us make 2 separate slides for this one. Sorry. So this is number 3. So categories over. Fine. Next one, 1, 2. Right. 2 and 3. Examine. Okay. Right. So you have to examine these things. And then number 4, examine is over. So check whether. So check whether. Right. This is 4th slide. Okay. 1, 2, 3, 4. 4th slide. Examine. Then one more slide, because this is the bigger one. Okay. This is management. Management. You should know how these things are segregated. then only it will be easy for you to understand. Yes, fine. Okay, now it is fine. So this is the fourth one. So yes. So this is the fifth slide. So simple fractures. So simple fractures have three different things. So till here. Okay. So first one is immediate management, then clinical assessment, then management. So this is everything about management. So management of simple fractures, you can say. Simple fracture of limb, simple fracture. So that is management. So you can consider this one as management of fractures. So how to manage ordinary things? Just managing, right? So we can consider as simple fractures management. So remember this one, this is management. So let us take the title, management, simple fracture management. Management. So one word I have taken. Why so big? We know that it is simple fractures, no problem. I'm making it simpler. So management is the word. So second text is related to management. Management. Fine. So next we are going to part C. Okay, before going to part C, yes, let me show you all these five. So this is text A. Text A. So go through this one now. So fracture, dislocation, and sprain. Okay. These bold letters tell you that this is related to something which is very important, that is the categories. Right. So this is text A. Okay. Okay. Now then we have text B. Text B is here. Text B 1, slide number 1. So you can just, I can show you when the answers come, no? It will be easy for me. So that's why. Text B is related to, okay, text B. Text B. Okay, what we can call text B is management. Okay, brackets, simple fractures. Management of simple fractures. So the words for this one is management. Sorry. Management or assessment or examination or administration or supervision. These are some words, not exactly, but they are synonyms. You'll get something. Okay. Right. Management, assessment, examination, administration, supervision. These are all some. Okay. Simple. Simple means Okay. Simple. Simple means common, usual. Synonyms you have to learn. Otherwise, you will not get the answers. You will never get the answers if you don't know this. Simple, common, usual, normal. Simple, common, usual, normal, ordinary, general. See how many words you may not even think that this many synonyms are there. Simple, common, usual, normal, ordinary, general, casual. Okay. Uh, Simple, common, usual, normal, ordinary, general, casual. Okay. Fine. These are some synonyms. So these questions will be having these words: management, assessment, examination, administration, supervision, or simple, common, usual, normal, ordinary, general, casual. Love these things. So if you get these words, it will be easy for you to understand. Right. Now, this is immediate management. So this is slide 1. Next one, slide 2, it's talking assessment. See, clinical assessment. That means it is in the clinic after going to the clinic. That means previous one was before going to the clinic. Okay, fine. Before going to the clinic, after going to the clinic. So clinical assessment. Assessment means, okay, what happened? Judgment. Okay, right. Or diagnosing. Diagnosis also is there. So print a screen. Then next one, this is examine, means examination also is another word. See, I'm telling you, all these words will be there. All these words will be there. So assessment is there, management is there, examination is there. See, I told you, everything will come. So the words you can see here. First one is management. Second one is assessment. Third one is examination. See, what all I told you is coming. Are coming, sorry. So next one. So next one is examine over. Yeah. Next one, check, checking. See, another one is checking. Checking is another word. It's very simple. You learn new different types of words. So the other word is checking. Then next one, again management. Okay, administering. See here, administer. See here, administer means administering. So all these words will be there. Administration, I told, it is there. So now see here, one more word I am adding here: supervision, checking. Read it. Another word is checking. Checking. So that is another word I added. So like this, you'll get new words. You can add to your vocabulary. You can build your vocabulary. Right. So how to analyze the question is more important. Once you analyze the question, it will be very easy for you. Right. Next one, we are going to part C. So text C, sorry. Text C. Text C, what is the title? We don't know. Title. Title is what? We don't know. So now let us identify the title from here. Okay, text C is in second page. So here. Okay. Edit, take a snapshot. Yes. So there is text C. Okay. Now text C, what title we can give? Let us see. Fine. Yes, here it is. So this is one copy. So this is drug protocol. Okay, and then in between there's a picture. There's a picture, not picture, table. There's a table. So there's a picture and there's a table. Okay. So here this is a table. So fine. Next one, again there is information at the bottom. Okay, this information. That table I give you separately in a new slide. Copy. Okay. Right. So this is home 28. Okay. Home 28. Okay, fine. So this table, we can put it in the middle. Yeah, this is the table. Yes. Now, the table is there. That table we'll put in the next slide. Okay, what can we do? He's telling drug therapy protocol. So this is regarding drugs or therapy treatment. Drug means, medication. Therapy, treatment, medication, drugs, treatment, or whatever it is. So it is dosage. So dosage, this is all related to drugs and medication. So we can say this is medication or treatment. So this is treatment or medication. So medications. Fine. Then we'll take another slide. So this is one. So medications by one. Okay, this is medications, control C, V. Okay, this is medications by two. We are going to take the table here. Right. Okay, fine. This is the table. Let us take the table from here. Edit, take a snapshot. Because otherwise it will be difficult to, if we put it in one page, it will be difficult. So I am giving you the table. Okay. Copy and paste. Yeah. So that would be fine, I think. That would be fine. Okay. So we have medications by two. So here also you see drug, morphine, ampoule, then dosage. Okay, all these things, medication are there. Okay, fine. So this is text C. So here he is telling drug therapy protocol. So from this you can understand it is related to drugs and medication. Drugs and medication. Okay, here also you can see he's talking about drugs. See here, drugs. Drugs. Fine. Yeah. So here, this is text C. Text C. Okay, title is medications or drugs. drugs, medication, dosage or treatment, drugs, dosage, treatment, drugs, dosage, treatment, medications, dosage. Okay. So the other words are drugs, treatment, dosage, and there is another word. It's that word I'm not getting. Okay, fine. Okay. So that is ecstasy, that is medications. So now the second page, print screen. Yeah. Now we understood everything now, what it is. Without reading anything, you will tell me the answers. Without reading anything, you will tell me the answers. This is guaranteed. I'm sure. Okay, fine. Next one. Okay. Now let's go to text D. Text D is here. Text D is here. Right. Okay. Text D. Now what, sorry. What is a text D all about? Fine. Okay. In the beginning, it will be difficult, but afterwards, it will be very easy. Title is what? We don't know. So now let's go to the this one. Technique for plaster backslab for arm fractures. Use the same principle for leg fractures. So arms and legs. This is also for limbs only. For limbs. Forelimb, hind limb. Means forelimb, hands, hind limbs, legs. So he's telling about that. So simple as that. This is plaster backslab. Plaster backslab. Plaster backslab. Finished. So okay. పూజ చేసిన అయిపోతే ఫ్యాన్ అయినా చిన్న 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 5 times I called you, but you are here, but you are not in the house. That's okay. When it's okay, you can listen all the time when you are in the house. At least switch on the fan, please. Huh? Daddy కోపం చేయడు అని daddy will not shout అని ఇష్టం వచ్చినట్టు చేయకూడదు. So fine. So 8 points are there here. Okay. 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 So I don't want this. I'll take something else. Sorry. See. Okay. So this one. Text D. Take one test, anything which you want. Title is equal to question. Okay. Copy. Control. Okay. Okay. can reduce a little. This is better. So 1. This is not fine. This is fine. Okay. When you do something, you should do very nicely. Some students are there, they don't know how to write neat handwriting also. I feel very sad. Okay. They'll throw their handwriting as if they are throwing to the food to the beggars. They don't know how to carry themselves. Because if you write nicely, then you will get an impression. Okay. Right, 8 points. So this is technique for plaster backslab. So this is the point. This is only first line you have to read. And this is plaster backslab. Okay. Plaster backslab, you can say. This is better for that. Plaster backslab. You can take the title plaster backslab. That's all. Okay. So this is text D. So now we have done with the 4 things. This is text D. It is plaster backslab, or you can say serious fractures. You can take anything, or difficult fractures. Okay, serious fractures. Okay, whatever you want. Okay. Right. So now you will understand how easy and how simple it is to find the answers. Get ready now. The questions we are going now. The questions we are going now, and I'll show you everything. You should only identify which text it is. All the questions, which part it is, you have to tell me. That's all. I'll tell you whether it is right or not. Then afterwards you can find what is the answer for this one. So question numbers will go now. Right. Question numbers will go. Fine. So now texts are over. Next one is questions. Okay, the questions. The 20 questions. The 20 questions. How they are segregated. Now let us see the questions. Okay. So here is the question paper. So I don't want the first page. I don't want the last page. Close it. And I wanted to edit all unwanted things which may disturb our study. So, right. Yeah. So there you are. So 20 questions. Out of 20 questions, there are 3 groups now. So first one is question 1 to 7. First group. So three parts. Part it's set one, set two, set three. Three sets of questions are there. Three sets of questions. You should know all these things. First of all, what they are. Just answering is not sufficient. Okay. Now there are three sets. So A, or you can say set one. Set one is, what is set one? Set one is, okay, finding information, finding the location. Find the location where the information comes. Identifying information. Where is the information? Identifying the location of the information. It is in text A or text B or text C or text D. Identifying the location of the information. Identifying the location of the specific information. So that is the topic. That is the style of questions here. Identifying the location of the specific information. I'm not finished. We finished everything. Finished everything. So we are coming to the questions now. Okay. Set two. Set two is, okay, first this set one is 7 questions. So there we have 7 questions. 7 questions. Right. Set one. Yeah. Next, set two. Set two is question, short question answer, short phrase. So these are questions, short answer questions. So set two are short answer questions, and how many are they? 8 to 14. 8, 9, 10, 11, 12, 13, 14. 7 questions are there. So these are also 7 questions. So these are short question, short answer questions. And these are 7 in number, 7 questions. Then next one, set 3. Set 3. Set 3. So you have 15 to 20, that is 16, 6 questions, 15, 16, 17, 18, 19, 20. 6 questions, and these are fill in the blanks. Fill in the blanks. Using short word and phrase, but fill in the blanks. Completion, sentence completion, or fill in the blanks. So these are fill in the blanks types of questions. Fill in the blanks. These are 6 questions. So fine, you got it. Set 1, set 2. Yeah. Identifying the location of the specific information. 7 questions, right? Fine, that's good. So the 20 questions are divided into 3 groups. Set 1, set 2, set 3. Actually, I don't know whether you know all the different types of questions which come in part A. Okay. So that we'll discuss it on some other day. So here there are 3 types. Okay. Total 5 will be there. There are 3 types we are going to use now. So set 1 is identify the location where, in which part. But set 2 also same. Set 3 also same. You don't know that. Set 2 and set 3 are an extension to set 1. So for set 2 also, set 3 also, you have to identify where it is to identify the answer. So first find the location is important for all the 20 questions. For all the 20 questions, you should identify where it is. You should identify where the question is. If only you identify where the question is, then only you can understand. So right. Why I put yellow? Okay. Right. Identifying information, short answer questions, and fill in the blanks. These are the three different things. So, now go through the questions. Right. I'm going to give you the options now. A, B, C, D options. I'll give you a quiz like everything I'll give you. This is part A. I'll give you a different type of testing, which nobody gave you. Okay. So this is right. 20 questions. The question types. The question types. So the three question types. Okay, the given three question types. Okay. But what you have to do is for all the 20 questions, you have to follow the same approach in the first stage. For first 7 questions, same approach enough. No need anything else. But second and third questions, along with the questions which you approach which you do, you will use additional approaches. For the first one, you will take only one step. For the second one, you will take 2 steps. For the third one, you will take 3 steps. Okay, I'll show you as we go. Now, these are the questions we have noticed. So, 20 questions. Right, we are coming to the first question. Right. First. Chinna, you stay with me only today, please. Huh? Okay. You stay with me today only. My mind is not fine today. Okay, you go log in and come. Okay. Right. So, maybe afternoon డాక్టర్ దగ్గరికి వెళ్ళొద్దాం బీపీ కొద్దిగా ఎక్కువ అవుతుంది నాకు బీపీ చెకప్ చేసుకొని రావాలి ఓకే చూద్దాం okay so these are the okay 20 questions okay now first set okay the 20 questions okay the question this the first set the questions set 1 okay they are 1 to 7 okay. Questions 1 to 7 okay the set 1 questions 1 to 7 so we are seeing 1 to 7 questions now let us see okay so, okay so this is 1 number 1 okay right Just 1 minute. Okay, fine. So this one will make, so the options will make what color? Okay, yeah, this color we can take red. Okay, and this one will take yellow. Okay, and now control C, control. Okay, this one will take green. No, no, white. White. Yeah. So, okay, fine. Okay, right. Yeah. Right. Okay, sorry. Phone. And then 28. Okay, fine. 32, 36. Right. Only first one will be little time consuming. Afterwards, it will be easy. So this is question number 1. Okay. Question 1. Six. Six. Okay. Okay. Now we know 4 different things, A, B, C, D. So which is the right answer? You have to say here. So those 4 are A is okay. ఏనా? జాగ్రత్తగా పో. జాగ్రత్తగా పోయి జాగ్రత్త. Okay, జాగ్రత్తగా పోయి, go safely and come safely. Okay. I don't want anything. Okay. So fine. A is what is A? Categories. B is management of simple fractures, management of simple fractures. Simple also I'm putting here for your convenience. Okay, C is medications, and D is what? Plaster backslap. నేను వేసుకున్నా ఇందాక ఇక్కడ పెట్టిన ఇక్కడ పెట్టిన చూడు. So plaster back slab. So these are the options you can take. 1, 2, 3, 4. So yeah. Okay. In which text can you find information about procedures for delivering pain relief? So now I'm going to ask you this question. Yes, this is the question. In which text can you find information about procedures for delivering pain relief? That white color is the question. Other than that, you need not read anything. Don't read anything. Procedures for delivering pain relief. Procedures for delivering pain relief. Okay, fine. You have to go to that. So think about that one now. I don't want you to do anything. Then what I'll do is, I will give you in the Telegram channel. You can go to the Telegram channel there. There I'll give you question number 1. Question number 1. Question 001. Okay, question number 1 I gave you. This is the link of the Telegram channel. This is the link of the Telegram channel. Okay. Now here I'm giving the link once again. You can go there, and I'm going to, don't write anything there. Don't write anything there. You have to just put A, B, C, D. I'll put there. I'll put the option there. Then you can write there. Okay. So you have to think about this one. Procedures for delivering pain relief. Pain relief. It comes in categories, or management of simple fractures, or medications, or plaster backslap. Just guess. Pain relief. Pain relief. That is the key option there. Pain relief. You have the choice. Pain relief. Pain relief. Now, I'll put the answer in the Telegram channel. Okay, I'm passing the screen because you should not see what, okay, passing the screen because you should not see what answer I'm giving there. So I'm giving the answer there in the Telegram channel. So here, okay, question 001. So create poll. Create poll. Question. So logical reasoning. Inductive method. Inductive method. Inductive method. Inductive method. No, this is deductive method. Sorry. Deductive method. So both are applicable. So now the answers are A, B, C, D. So now, yes, I have given the answer there. You can tick your answer there. Just without reading anything, you can get this answer. In which paragraph you will find? In which paragraph you will find this information? Chinna? In which paragraph you will find this information? Okay. One candidate has given wrong answer. Okay, fine. Okay, so you can answer in the Telegram channel there. You will know whether it is right or not. Afterwards, I'll discuss with you. I'll discuss with you. All of you go to the Telegram channel. Yes, you can go to the Telegram channel and you can check the answers there directly. So it's so easy. Without reading, you'll get the answers. Without reading. That's what I'm telling you. Without reading, you'll get the answers. Yeah, tableau. You have to put in the tick mark. Okay. You have to click on the circle there. You should not write answer there. You should click there. A, B, C, D. You should click. Then you'll get the answer. I will not tell you answer there. It will automatically tell you. So what you have to do is you click on that circle before A, B, C, D, before A or before C or before C, D. There is circle. So that circle you have to click. Then it will say, if it is right, it will show green color. If it is red, it is wrong. That is what it is. It will shake. Okay. So that is how you will identify the answer. Okay. 14 students are there. Still only 9 students have given the answer. Still only 9 students have given the answer. Okay. Now if we see pain relief. Yeah. Now pain relief. So here, when you say pain relief, procedures for pain relief. Now, pain reliefs will not come into categories. If you have pain, you will be given some tablets or injection or ointment or some cream or something. So it is medication. It is medication. Just like that, you can tell. Am I mad to go and read everything? I don't want to make a fool of myself. So I am very clear. I am very clear with my understanding. Categories means different categories. Management means manage the situation. Okay, medications means giving drugs or tablets or medicine or injections or ointment or cream or balm. Pain, headache, you have cream. That is medication. A plaster backstab means when the serious fractures are there, you will put a plaster so that it will not move. So you will make it strong. Okay, tighten it and make it strong so that it will heal fast. So that is how you have to answer. Okay, now pain relief is the keyword here. The keyword is pain relief. Pain relief is the keyword. This will help you in finding the answer. So this will help you in finding the answer. There will be 1 or 2 words which will help you to find the answer. Okay. నాన్న చిన్న అది నేను నీకు ప్లేస్ చెప్తాను ఆ ప్లేస్ కి నాకు టికెట్స్ బుక్ చేసే ఓకే see how is the situation in Kerala and let me know. So procedures for delivering pain relief. Pain relief is the point here. So pain relief will tell you relieving pain, you take medications. Headache, you have pain, so you'll take Jandu balm or some other balm or cream. and you apply something there, or you take a tablet. It's medication. Very simple. So for this one, why do you want to read? There is no meaning in reading. So that is a clue word you can take. Okay, still only 10 students have given the answer. Okay, that is pain relief. Okay, next one. Okay, next we are moving to the next question. Second question. This color is not very attractive. Okay, that's fine. What we can make is we can make this size a little bit. No, that's fine. Absolutely fine. No worry. No worry. Okay, next one. Uh, hello. Anna Shobha. నిన్న సండే కదరా వీకెండ్ కదా ఇవాళ వస్తున్నాయి కదా స్టార్ట్ చేస్తున్నాయి కదా అది ఓపెన్ క్లాస్ తీసుకున్నాను జస్ట్ అదే రెగ్యులర్ క్లాస్ కాదు అది ఓకే నేను ఇప్పుడు క్లాస్ అయిపోయిన వెంటనే కాల్ చేస్తాను సరేనా రైట్ సో categories management medication and plaster backslap so we'll go to second question question number 2 question number 2 is okay here the procedure to follow when splinting a fractured limb. Okay. So, the procedure to follow when splinting a fractured limb. Splinting a fractured limb. Fractured limb. Splinting a fractured limb, you have to remember. Now, splinting a fractured limb. Splinting is the keyword here. Splinting is a keyword here. Splinting a fractured limb. So, splinting. What do you mean by this splinting? If you understand that one, you will get the answer. So splinting a fractured limb. So I am going to the Telegram channel. Okay. So I am passing the screen. I am going to the Telegram channel and I am putting there. So question 2. Question 2. So now there you have the answer. Splinting a fractured limb. The options are A, B, C, D. So you have the options. Create poll. So options are A, B, C, and D. Okay, quiz mode. It is inductive method. Inductive method. And then the answer. Yes, you can go for the answer. Yes. So I have given you the option there. I have given you the option there. So you can tick out the answer which is right. Okay. Yes. Second question. Amma? చిన్న బాబు ఎక్కడ ఉన్నారు? లేడా? Right. So you got the answer. అమ్మ దగ్గర ఉంటే తీసుకొని నేను అమ్మకి ఇస్తానని చెప్పు. నేను సాయంత్రం తెచ్చిస్తాను. లేకపోతే నేను తెచ్చి పెడతాను, రేపు తీసుకో. ఓకే. సరే నేను తెచ్చి పెడతానులే అయితే. రేపు పొద్దున్న తీసుకో. So then the third question. Okay, but before that one, let us think about this question. So what is the right answer for this question? Let us see here. So the procedure to follow when splinting a fractured limb. So when you say splinting a fractured limb, splinting a fractured limb, that means it is not an ordinary this one. It is a serious fracture. So it's plaster backslab. You can think like that. So only then you can get the answer. Right. So splinting a fractured limb, splinting, it doesn't come under categories. It is not simple. It is serious. It is not medications. So it is a serious fracture. You know that. So because of that, you will go there. So splinting means it is a serious action is going on there. A fractured limb, splinting a fractured limb. How are you making it? How are you going to set it right? Already fractured. You have to take some serious measures. So, right. Next one. This is the third one. What to record when assessing? Okay, copy. So there you saw splinting, but here it is assessing. The word is assessing. Assessing. What to record when assessing a patient? This is assessing is the keyword. Based on that one, you have to get the answer now. Based on the word assessing, you have to get the answer. Take the word assessing and analyze. Assessment, where it will come. Yes, I'm going to Telegram channel once again. Right. Question 3. 003. Question 3. Right. So this is the screen. I am passing the screen. And in the Telegram channel, you can check it out there. Create poll, Control V, quiz mode, A, B, C, and D. Okay. A, B, C, and D. Deductive method. Reductive method. Okay. Third question. Assessment. You know assessment now. Assessing a patient. Yes. Right. Next, fourth question. Question number 4. The terms used to describe different types of fractures. Types of fractures. Many people don't know why they are reading. Okay. The terms used to describe different types of fractures. This is question. Yes. Question number 4. The terms used to describe different types of fractures. A. Categories. B. Management. C. Medication. D. Plaster backslap. So those are the related words. Print a screen. Okay, I have passed the screen. Yeah. Question number 4. Question number 4. Sorry. Okay, question number 4. Types. Oh, sorry. I should have underlined the types. Types is very important word. Okay, types. Types will help you to find the answer. Types is the word which will help you to find the answer. Types. Okay. You can go to the Telegram channel, create poll. Question number 4, quiz mode, inductive method. Bold, quiz mode, A, B, C, and D. Okay. Question number, which one is this? 4th one. Yes. 4th is the answer. 4th question. 4th question. You can tick. The word, clue word is types. The clue word is types. Clue word is types. Then the 5th question. Fifth question. Question number 5. Okay. The practitioners who administer analgesia. We got the other word here. Okay. Now you got a new word. Analgesia. Real 36. So the new word is analgesia. So analgesia is the clue word. Analgesia means what? Categories: management, medication, plastic backslap. So analgesia means what in these three things? What in these three things? Analgesia means what? So print a screen. I'm pausing, resuming the screen. Yeah, I have resumed the screen. I have passed the screen. So now you have to think about this one. Yeah, fifth question. Question 005. 005. Fifth question 005. Right. Right. Fifth question 005. And next, answers. Uh, so A, B, C, and D. Okay. So this is fifth question. Quiz mode. Okay. Deductive method. Analgesia. Okay. Analgesia is related to what? Okay, resume share. Analgesia is related to what? Fifth question. Fifth question is there. Analgesia, fifth question. What do you mean by analgesia? Then you will understand it very clearly. One word is enough. Next one, sixth question. Sixth question. Sixth question. What to look for when checking an injury? Checking. What to look for when checking an injury? What to look for when checking an injury? Okay. So checking is the keyword. Checking means what? So I am passing the screen. Okay. So checking means what? Check it out. Checking means what? Yes. So question number 6. Question 006. Question 006. Right. Checking means what? See from the 4 words. Checking means what? Okay. Okay. Sixth question. Yeah, I have given the answers for the sixth question. Then last seventh question. So last is the seventh question. Yes, resume share. So seventh question. How fractures can be caused? Causes. So control C. How fractures can be caused? So how fractures can be caused? Yeah. So fractures can be caused. Causes. Different causes. Here different causes for how fractures means different types of fractures can be caused. So causes. Is it in types, or is it in simple fractures, or is it in medications, or is it in backstab? You analyze. Question number 7. Okay. Question number 7. Types, causes, fractures. How different types of fractures can be caused. Means reasons. Okay. So try to analyze the question and then give your answer. Question 007. Okay. Okay. Right. You can see the next question. I'll put it in the Telegram channel there. Okay. Question number 7. Yes. So we have understood now how to do multiple choice questions 1 to 7 without reading. We understood how to do multiple choice answers without reading. Okay. Yes. Amna Sohail. Amna Sohail. Is that clear for you, Amna?
Hello. Yes, sir.
Very clear?
Yes.
Hello, Amna.
Hello. Yes, sir.
So can you tell how it is beneficial, this technique?
Sir, we can find the answers without reading the passages just by the keywords.
So is it
And
beneficial? Tell me, tell me.
Yes, their headings and just the keywords.
Yeah. So how are you able to manage with these things? Okay. Right. Chinno. Hello, Chinno.
Good morning, sir.
Good morning, Chinno. How are you?
Fine, sir.
Did you understand the new technique?
Yeah, yes, sir.
Okay.
Yeah.
So you have to apply the same style. Okay.
Yeah. Oh, okay, sir.
You have to apply the same style and you can use it. Is that clear?
Yeah.
If you apply the style, you can definitely get everything. Okay.
Okay, sir. I will try like this.
Yes, you try like this, some other passages, and you learn these techniques. Okay.
Okay,
Right.
sir.
And at 2 o'clock, at 2 o'clock, I'll teach you questions 8 to 14. Okay.
Okay, sir.
8 to 14, I'll teach at 2 o'clock.
Okay, fine.
So 2 o'clock, we'll have lunch, then we'll have at 2 o'clock. Okay.
Okay.
Right. Android Blue Droid. What is this Android Blue Droid? Wonderful name. Hello, Mr. Android. Okay.
Hello, sir.
Hello, who is this?
This is Sanju Sarin, sir.
Anju. Okay, Anju, you can hide your video.
Yes.
You can stop your video. Okay. Yeah, Anju.
Okay.
Anju, what is the
Okay.
second name?
Serin.
Anju Serin. So whenever you come with the
Yes,
name
sir.
Anju Serin, okay? Right?
Okay, sir.
While joining,
Yes, sir.
it will ask you what is your name. You say Anju Serin, it will be easy. Now I changed it, okay? So,
Okay, sir.
because if it is some other name, no, I will not permit sometimes. Okay?
Okay, sir.
So
Okay,
regular
sir.
students who don't have names, no? So I will not allow, if they don't bring, they should come their names only, because anybody cannot come, no, for these classes. Huh? So only for our students only can come. So Anju, did you understand the new techniques or no?
Yes, sir. I understood
Yes.
the
Okay.
new
What?
technique.
Okay, fine. You try like this one, all the questions. And after some time, I'll start at 8 to 14. Next, FC.
Okay.
FC Lefisa. Hello, FC. Leiby.
Hi, sir.
Hello, Leiby.
Hello.
How are you?
Yeah, fine, sir. How are you?
I'm
Hi,
fine.
Dr.
I'm
sir.
fine. Are you able to find the techniques, Leiby?
Yeah, yes, sir. Yes, sir.
Apply these techniques every time, okay?
Okay, sir.
If you practice, I teach you the techniques, but see, when after buying the car, you should use it, no, regularly.
Yes, yes, sir.
Techniques are also like that only. You have to use it regularly, okay?
Okay, sir. Thank you,
Right.
sir.
Thank you. Next one, Manjusha Matthew. Hello, Manjusha.
Hi, sir.
Manjusha, is that clear, the new technique?
Yeah, sir. I
Are you
understood.
able to understand how to identify? Did we read anything first of all?
No, sir. I find out only which topic, which A or B or C.
Uh,
Yeah, without
so
any reading.
without reading, are we getting the
Yeah.
answers or not?
Yeah, I got the answers.
Yeah, very good, very good. Okay.
Yeah.
1 second. I want to ask you
Okay.
how many marks you got. Right down here. Your score, please. Your scores. Type and keep it ready. Don't submit now. When I tell you submit your scores, then only you have to submit. Okay. So out of 7. Okay. So don't submit until I tell you to submit. Your scores out of 7. Okay. So when I tell you submit, that time only you have to submit. Okay, 5, 4, 3, 2, 1, submit. Submit your scores, all of you. How many marks you got out of 7? You submit. Serena got 6, very good. Leiby got 6, Suparna got 7. Who is this iPhone? I don't know. Chinnu got 7, Manjusha got 6, Amna got 5. Okay, who is this iPhone? Hello, iPhone. Can you tell your name, please?
Hello, sir.
Hello, iPhone. Can you tell your name, please?
Hello, sir. Am I audible?
Yeah, you are audible. Tell me.
Sir, I'm Prabjit.
You are?
Sir, Prabjit.
Prabjit. Okay. You typed it already. Okay. Prabjit. Very
Yes,
good,
sir.
Prabjit. Yesterday I was trying to reach you. Okay, you missed. Okay, fine. Right. Next one. FC Lefisa to everyone. Can I have Telegram link? So Telegram link was given there, but I'll give you again. Okay, Telegram link is here. So that is one link, and this is second link. Both the links you can use. Okay. Yeah, fine. So Prabjit, is that clear, Prabjit?
Hello, sir.
Is that clear to you?
Yes, sir. Yes, sir.
Okay, at 2 o'clock we'll have questions for 8 to 14. Next, FC.
Okay.
Share your experience, FC. FC, I cannot hear you. Okay, Rajiv. Yeah, FC, tell me.
No, everything is fine so far, sir.
Yeah, you are able to understand. Very good, very good. Okay, Rajiv. Serena.
Yes, sir.
Hello, Serena.
Hi,
Are you
sir.
able
Good
to
afternoon.
follow the techniques now?
Yes, definitely. I already started to practice like this, sir.
You already started to practice, and are you enjoying it or no?
Yes, definitely.
Or are you still crying?
No.
Many people cry. We don't want to cry. We want to dance. Okay.
Yeah.
When you get good result, we'll all dance together. Okay.
Yeah, sure.
Okay. Next, Next, Suparna. I know Aparna, but this name Suparna is something different, special. Hello, Suparna.
Yes, sir.
How are you, Suparna?
Fine, sir.
So you asked me, I want to come in the evening, but you came in the morning. Did you get some additional benefit or no?
Yes, sir.
How many sessions you attend, that much benefit you will have, okay?
Yes, sir.
Yes. What benefit you got today? You tell me.
Today, this part A section, I
Hmm.
easily to understand these points.
Okay, fine. So be ready. 2 o'clock we are having another session. That is 8 to 6, 14 questions. Okay, Tibello. Hello, Tibello.
Yes, sir.
Yeah, is that clear, Tibello?
Yes, it's clear, but I can't find where I can get the answers, your answers, because I have already
Okay, the
answered in
answers are
Telegram.
there in Telegram channel. Okay, if you go there, you can click there only. You'll get the answers.
Okay, the green ones are the correct ones.
Yeah, the green ones are the correct ones. Yes, absolutely. The red ones are the mistakes.
Okay.
Okay.
Okay, it's clear now.
Right. Yes. Okay, fine. They are only answers. If it is correct, it will show green, and it will throw
Okay.
flowers.
Thank
Okay, fine. Okay, so we will meet after 1 hour exactly. Okay, we'll meet exactly after 1 hour. Thank you all for attending this session. The next session for questions 8 to 14. Okay, 8 to 14 will be at 2 p.m. Okay, 1400 hours. 1400 hours IST. Okay, only for regular students. Only for regular registered students. No, but don't give this link to anybody because I am only not giving. So if you give, then I'll ask you why you gave. So don't give this link for anybody, please. Okay, right. Okay then, bye bye, see you.